Perfect. So there it is, and here it is a few seconds later. So today I'll talk about the impact of animal-assisted therapy on patients undergoing stroke rehabilitation and the welfare of therapy dogs. So this was original research that was performed by Purina in 2023 and 24 and presented in 2025 at the International Society for Applied Ethology and also at the International Association of Human-Animal Interaction Organizations. And so both of these studies are being published. One was published last year, and the other is currently under review. And the nice thing is that we're wanting to do, or we did a random controlled study to demonstrate the benefits of animal-assisted therapy. And also we wanted to make sure there was no negative impacts for the dogs that participated in this animal-assisted therapy. So first off, what is a stroke? A stroke occurs when blood supply to the brain is reduced, resulting in deprivation of oxygen and nutrients to brain tissue, which in turn leads to hypoxic injury and neuronal death. And it is a medical emergency that requires prompt treatment to minimize potential complications such as paralysis, difficulty talking, dysphagia, memory loss, mood disorders, pain, behavioral changes, and functional decline. So what are the key objectives of stroke rehabilitation? It is to maximize functional recovery and facilitate physical independence through formal rehabilitation. And this includes both physical therapy and occupational therapy and speech therapy. So physical therapy and occupational therapy is to prevent complications resulting from prolonged inactivity and improving motor function recovery. Speech therapy is for restoring language, understanding, and communication skills. There are also challenges associated with stroke rehabilitation, and commonly reported barriers to comply include lack of motivation, desire and energy, lack of companionship, lack of interest, and depression and anxiety. And so this has been linked to poor functional outcomes during rehabilitation. There is some literature on animal-assisted therapy and stroke rehabilitation. A number of studies have low sample sizes, a few have slightly larger sample sizes, and we wanted to contribute to adding to this body of literature showing the benefit effects of animal-assisted therapy. And so the aim of the study was to investigate the benefits of integrating animal-assisted therapy into stroke rehabilitation using a larger scale randomized controlled trial to quantify changes in patients' quality of life, mood, functional recovery, and physiology. And so our working hypothesis was that the addition of therapy dogs to conventional rehabilitation would have a positive effect on patients' overall well-being and that they would exhibit improved functional outcomes. So for this, we worked with the Mayo Clinic, the largest integrated not-for-profit medical group patient practice in the world, with campuses in Minnesota, Arizona, and Florida, and a network of regional clinics and hospitals and international locations. And caring canines are part of Mayo Clinic's commitment to healing of mind, body, and spirit. And the highly trained pets soften the impact of being a patient in a medical center by providing an opportunity to receive warmth and unconditional love from an animal. So the methodology. We had 50 patients randomly assigned to a control group receiving regular standard stroke rehabilitation and an experimental group that received the standard stroke rehabilitation plus animal-assisted therapy. All participants had had a recent stroke, were hospitalized in the stroke rehabilitation unit of the Mayo Clinic, and enrolled in the inpatient brain rehabilitation program, and this was done between February 2023 and 2024. Inclusion criteria for the study included having had a recent stroke of any cause, being able and willing to provide informed consent, and be able to speak English. And exclusion criteria were being allergic to or fearful of dogs, having a pacemaker or being pregnant, or being deemed inappropriate for the study by the medical or research personnel. The therapy dogs and handlers, so there were 14 therapy dog handler pairs, all part of Mayo Clinic's Caring Canine program. They were registered as therapy dogs with either the Alliance of Therapy Dogs or Pet Partners. And all therapy dogs were always accompanied in their handlers in the diamond model, where you have the patient, the doctor, the animal, but also a handler for the animal so that the doctor doesn't have to take care of both the patient and the animal. So that diamond model is important. We used validated questionnaires and scales to measure the outcomes. So we used the stroke-specific quality of life scale to measure health-related quality of life, the generalized anxiety disorder scale to measure the presence and severity of generalized anxiety, the patient health questionnaire to measure the presence and severity of depression, the Pittsburgh Rehabilitation Participation Scale to measure patients' participation and motivation in rehabilitation. We use the self-care and mobility quality measures to quantify patients' functional recovery, and there was also a pain score and the length of stay in rehabilitation. We also used non-invasive physiological measures that were measured both for the patients and for the dogs. So as we saw this morning, we measured cardiac activity, heart rate variability that measures emotional well-being, stress, physical activity, which measures functional recovery and movement, the tympanic membrane temperature, salivary cortisol, and also salivary oxytocin. The experimental design for the inpatient stroke rehabilitation patients was first being admitted into the unit, being assigned to either the experimental or the control group, going through the questionnaires. Then rehabilitation started with the control group getting 15 hours of occupational or physical therapy in the first week, and the experimental group getting those 15 hours, but having 3 of those sessions added with 30 minutes occupational therapy. There was the oxytocin, the cortisol, and the heart rate variability measures taken, and the questionnaires administered after 1 week. And this was repeated again in the second week of the rehabilitation. For the dogs, the experimental design was a little bit different. So before the 30-minute sessions, we took a saliva sample from the dogs, measured the tympanic membrane temperature, equipped them with the heart rate monitor, and measured them on the fear, anxiety, and stress scale score. They then did the 30-minute rehabilitation session with physical therapy, occupational therapy, and speech therapy for the patients. And then post-session, in the 15 minutes after the sessions, we took another saliva sample from the dogs, their tympanic membrane temperature, removed the heart rate monitor, and assessed them again on the fear, anxiety, and stress score. The treatment space, so at the Mayo Clinic, the treatment space had a physical therapy gym with gait trainers, stairs, exoskeletons, weights, treadmills, balance tools, parallel bars, and exercise bikes. The occupational therapy gym had therapy mats, fine motor coordination tools, and a reaction trainer. And there was also a rehabilitation simulation apartment that had a real-life home living environment with a bedroom, kitchen, and bathroom. So examples of activities performed during the animal-assisted therapy sessions. So all therapy plans and exercises were designed based on patient needs, therapist inputs, and clinical goals. And stroke rehabilitation standard care activities included sitting and to stand and holding a large exercise ball, stringing beads onto a thread, pinching or squeezing a foam cube, reaching and retrieving objects from an overhead shelf, or holding and moving a small ball through a diagonal range of movements. The animal-assisted therapies activities were similar, but also included the dog. And so there was petting the dog with the unaffected extremity while the therapist was performing strange and range of motion on the affected extremity, holding the leash while walking the dog, holding the leash and walking the dog while performing marching, tandem gait, squats, or heel raises, propelling a wheelchair while holding the leash and mobilizing the dog, and walking the dog while performing head turns and visual scans, or standing on an uneven compliant surface while petting or reaching for the dog. Okay, so what were the results? So the results of the patient questionnaires, pain score, and length of stay. So we found No differences between the control and the experimental group for the self-care, the mobility questionnaire, the health-related, or the depression and anxiety scales. However, we did find a difference for the motivation and participation in the rehabilitation, with the experimental group with animal-assisted therapy scoring higher than the control group. For the cardiac activity, we found no difference in heart rate pre and post sessions between the control group and the experimental group, but we did find some significant differences in some measures of heart rate variability. For patient cortisol, oxytocin, and tympanic membrane temperature, we didn't find any differences pre and post treatment between the control and the experimental groups. However, for patient physical activity level, we found that the average activity count was higher in the experimental group, and the percent of time spent immobile was lower in the group with animal-assisted therapy. So what does this mean? Well, we saw that patients in both groups improved over time. Patients were more physically active, more motivated, and more engaged during the rehabilitation sessions with therapy dog when therapy dogs were incorporated into the program. In addition, there were some changes in heart rate variability metrics that suggest that patients were also in a more positive emotional states. However, there was no difference between the groups in terms of patient recovery, mood, pain level, and most physiological responses. Some feedback that we received during the study was that a patient was positively responded to therapy dog as evidenced by vocalizing affection to the dog and improving mood during the session. One patient had less neuromuscular fatigue relative to previous days. One occupational therapist observed a patient reported less instances of pain during dog therapy sessions. And one patient recalled having no pain when interacting with the dog, but had reported a pain score of 8 out of 10 prior to seeing the dog when the saliva was being collected. So how can we explain the moderate effect of animal-assisted therapy in this study? Well, animal-assisted therapy accounted for less than 10% of the total rehabilitation treatment schedule, and the positive effect caused by the therapy dogs may have been short-term. Research has shown that the effect of reducing depressive and loneliness symptoms by animal-assisted therapy is more likely to be detected immediately after the subjects were visited by the animals, and the impact can rapidly decrease over time. And in our study, the questionnaires were often administered hours or even days after the animal-assisted therapy sessions rather than immediately after, due to logistical constraints at the Mayo Clinic and patient factors. We also know that physical activity influences cardiac and hormonal activities as well as other baseline physiological factors. And in this study, the animal-assisted therapy patients were more physically active and thus participated to a greater extent in their stroke rehabilitation treatment plan. And this could have had a confounding effect on the physiological measures we use to evaluate the effects of animal-assisted therapy on people with stroke. Okay, what about the dogs? We don't want to forget them. So these are the results for the therapy dogs pre and post session. So we see that there's significant difference in heart rate. So the dog's heart rate was lower after the physical therapy sessions. And many measures of their heart rate variability had increased post-session as well. There was no difference in salivary cortisol pre and post-session. A slight difference in tympanic membrane temperature for the right ear, and no difference in the canine fear and anxiety stress score pre and post-session. So the dogs had a decreased heart rate and increased heart rate variability values after participating in the sessions, indicating parasympathetic dominance and thus lowered stress states. And the cortisol and oxytocin levels remained stable pre and post-session. And the canine fear, anxiety, stress scores were similar pre and post sessions. So this shows that the use of multiple non-invasive physiological indicators of stress provides solid evidentiary support for the positive welfare status of the dogs used in these animal-assisted therapy sessions. And thank you.
Thank you very much, Jean-François. I think we have time for questions. That's exceptional, but we'll have also the roundtable after. So if there's any question from the audience here or online, now is the time. So if I don't see, is there any question? Well, I do have a question. So in your data, you showed that dogs that were participating in animal-assisted therapy had a little bit of lower heart rate. You just explained to us.
Yeah.
So what measures do you do to warrant that this is the case, to avoid that dogs can feel stressed during the therapy? So
I'm not sure I understand your question. Sorry.
So what measures do you do to make sure that dogs will not feel stressed during therapy?
Right. So there was a veterinary who was present at all times during the animal-assisted therapy who could intervene if they thought that the dog was being stressed, but that was never the case in the study. And also, we advocate for many of the groups that are trying to organize and structure how animal-assisted therapy is used. Because what we want to avoid is people doing these types of activities without necessarily thinking about the dogs, which could bring some welfare issues. But in our case, there was a veterinary present, and we adhere to multiple guidelines to make sure that we take care of the dogs.
Okay. And just one extra question, sorry.
Yeah.
So from your first talk, you presented multiple initiatives
Yes.
Regarding welfare. Which one do you think that has bring the most measurable impact, if you had to choose one? Because you presented many of them.
Well, that's not a question for me. Let's keep that one for the roundtable, because I know there'll be lots of people there who know this subject much more than me. So I know my limits of my expertise, and I'm not the best one to answer that.
No problem. Okay. So if that's okay, I think we can... Oh, there's a question there. Do we have the mic somewhere?
Yes.
Hi, my name is Matko. So what about the size of the dog for the therapy? Because maybe some of the human patients will scare with the large dogs and so forth. So do you have criteria for choose the proper breed?
So the dogs had been validated by different programs for animal-assisted therapy, canine programs, but yes, the participants could refuse to participate if they felt uncomfortable or didn't want to. So that was part of the exclusion criteria. If the person was allergic or fearful of dogs, they could choose not to do it. And that's one of the things. The Mayo Clinic is a very serious institution, and they have a very well-defined rehabilitation program. And so when we approached them wanting to work with them on animal-assisted therapy, they said, yes, okay, but you need to adhere to our guidelines. And so that's why some of the questionnaires could not always be administered right after the session, because the patients were going on to do other things, and we had to fit in the space when we could. But a good question, yes, if the people were uncomfortable or weren't having a good time with the dogs, they could stop.
Okay. Okay, so if no more questions, I think we can start with the roundtable. So we have some extra time for that, since we did not ask any questions during the talks. I think it would be good to start with that. So we will bring the chairs here, and we'll ask the speakers to come to stage. So thank you very much, Jean-François. Thank you very much.